Alright, so we're going to go over Parkinson's disease. What is Parkinson's disease? Parkinson's disease is a slowly progressive disorder of basal ganglia, usually occurring in late life, characterized by mass-like facies, resting tremor, slowing of voluntary movements, festinating gait, flexed posture, and muscle weakness, sometimes with excessive sweating and feeling of heat. There is a degeneration of dopaminergic neurons of the pars compacta, the substantia nigra, and dramatic decrease in the levels of dopamine in the substantia nigra and corpus striatum. What are four conditions, cardinal signs of Parkinson's disease? The four cardinal signs are resting tremor, rigidity, bradykinesia, and postural instability. What are some features that may be expressed by a person with Parkinson's disease? The features would include difficulty arising from a chair, difficulty turning in bed, microphagia, which is small handwriting, max face, stoop, shuffling gait with decreased arm swing, and hypersalivation. Sensory symptoms are also affected. Loss of smell is almost universal. Pain is very common. Other system movements can result in autonomic disturbance, depression, and a variety of speech disturbances, including dysarthria, palilalia, and stuttering. 50% of all patients develop dementia. What are the most common pathological features of Parkinson's disease? Loss of pigment in the substantia nigra, caused by loss of neurons in this region. Remaining neurons may show intracytoplasmic eosinophilic inclusions called Lewy bodies. Parkinson's disease is associated with marked striatal dopamine depletion. Many consider Parkinson's disease to be a striatal dopamine deficiency syndrome. At death, striatal dopamine loss is greater than 90%, and approximately 70% striatal dopamine loss results in system expression. Severity of dopamine loss best correlates with bradykinesias in Parkinson's disease. The correlation of tremor is very poor. Where are some of the morphological and chemical deficits in patients with Parkinson's disease? In the cholinergic pedunculapontine nucleus, noradrenergic locus coeruleus, serotonergic raphe nuclei, and glutaminergic centromedian parafascicularis complex of the thalamus. What is the most common cause of early onset of Parkinson's disease? The mutation of the Parkin gene, which is inherited in an autosomal recessive pattern. While it does occur, it is rare and known as familial Parkinson's disease. What are some treatment options for Parkinson's disease? Right now, there are no current treatments that arrest the degenerative process. Symptomatic treatments are the mainstay therapy, including pharmacologic and surgical interventions, as well as physical measures such as physical therapy, speech therapy, and exercises are important and have an important impact on the lives of patients with Parkinson's disease. Pharmacologic therapy of Parkinson's disease consists of dopaminergic agents that are the mainstay treatment of cardinal features of Parkinson's disease. Levodopa, which crosses the blood-brain barrier, whereas dopamine doesn't, and is converted to dopamine in the brain. Peripheral breakdown in the gut is inhibited by inhibitors of aromatic amino acid decarboxylase, and therefore carbidopa and levodopa are prescribed together, because carbidopa is aromatic amino acid decarboxylase. Catechol-methyl transferase breaks down levodopa to prevent this COMT inhibitors, such as entacapone and telocapone, are prescribed. Levodopa can also confirm Parkinson's disease, since 90% of patients with Parkinson's disease have a good to excellent response to levodopa. At least 600 milligrams per day levodopa with the aromatic amino acid decarboxylase. Dopamine agonists cross blood-brain barrier and act directly as primarily dopamine 2 type receptors without conversion. Agents include pramipexole, romanpyrrole, and bromocriptine. MAO-B inhibitors such as saligine and rostigilene can improve symptoms in both patients with mild disease and patients already on levodopa therapy. Anticholinergics such as trihexyphenidyl or diphenhydramine, brand name Benadryl, are used primarily to combat tremor, but have many sides, especially in elderly patients. Amantadine is felt to act primarily by blocking glutamate NMDA receptors and has a mild attenuation of the cardinal symptoms of resting tremors and dystonia. Recently, amantadine has been shown to alleviate levodopa-induced bradykinesia. Does any treatment slow the degeneration of Parkinson's disease? No, but the disease mortality has been reduced by levodopa therapy. Are there any sides to levodopa therapy? Yes, it is the most efficacious agent by treating Parkinson's disease, but over time, levodopa can cause an unstable response resulting in motor fluctuations, which are exaggerated clinical manifestations. Also, patients may develop troublesome abnormal involuntary choriform and dystonic movements called dyskinesias. To delay onset of dyskinesias, it is better to start treatment with a dopamine agonist rather than levodopa. Therefore, high-risk patients for dyskinesia should be treated with dopamine agonists such as pramipexole, ropinirole, and bromocriptine rather than levodopa. Patients that have an excellent response to levodopa will still have motor fluctuations and dyskinesias can receive surgical treatment that inhibit the subthalamic nucleus with high-frequency stimulation which provides excellent relief for the cardinal symptoms of the disease. Deep brain stimulation appears to be a preferable rather than surgical treatments, though. It is less invasive, more reversible, and can be adjusted to the individual patients, and remarkable results can be seen. In addition, inhibition of the ventromedial thalamus can be very effective for treatment. Now, got some questions for you all. Which of the following answers would suggest Parkinson's disease rather than other neurodegenerative diseases? Would it be unilateral resting tremor, supranuclear downward gaze palsy, early falls, or abnormal cerebral MRI? That's good. It was unilateral resting tremor. Early manifestation of Parkinson's disease is unilateral resting tremor. The other choices were more atypical of Parkinson's disease. Which drug reduces cardinal features of Parkinson's disease and reduces drug-induced dyskinesias? Would it be levodopa, dopamine agonist, or haloperidol? Good job. It was, sorry about that. Would it be levodopa, dopamine agonist, amantadine, or haloperidol? Oh, good job. It was amantadine. Amantadine, which can reduce levodopa-induced dyskinesia and yield attenuation of cardinal symptoms of resting tremor and dystonia by blocking glutamate MAS receptors. Glutamate NADPH receptors. If patient doesn't respond to levodopa treatment, what does it suggest? The patient needs a different Parkinson's disease treatment. Patient should get deep brain stimulation, or the patient doesn't have idiopathic Parkinson's disease. Great answer. The patient doesn't have idiopathic Parkinson's disease because most patients with Parkinson's disease will respond greatly to levodopa treatment. Alright, that was it for Parkinson's disease. Remember, comment down, subscribe, whatever you want to do. Just make these videos better. I'll get better every time for you guys so we can learn easier. Alright, take care. Peace.